research. What comes to mind when you hear that word? Well, for me, I used to think of working in a lab, and I knew that was never going to work for me because I could never focus my eyes while looking through a microscope. But thank goodness there are other ways of doing research, and what I'm going to talk to you today about is community engaged research, which is what I do. So many years ago, we used to do something called helicopter research, and that's a derogatory term because researchers used to just come into a community, they didn't tell anybody why they were there, they'd gather data, and then they would leave. And then sometimes they would reappear a few years later, and they would tell people how to live their lives, how to make changes in diet, in exercise, and all that kind of thing. And that really never worked because people really don't like being told what to do, especially when they haven't asked for the advice to begin with. So we know now that people need to have a stake in any changes they want to make on a community or a public level. And that's what community engaged research is all about. So what I'm going to talk to you about today is a model of community engaged research that we did at the University of Minnesota School of Dentistry and a collaborative practice organization. This is a 5-step model, and we go through a number of steps that are really recommended to keep both partners on track. And the first is called a needs assessment. Now this was a process that we did with Children's Dental Health Services. And I was teaching dental public health to dental hygiene and dental therapy students. And I wanted to find a collaborative practice setting for my students so they could do their service learning projects. And one of the groups that I interviewed is called Children's Dental Health Services in Rochester, Minnesota, not too far from Minneapolis, so it was a viable option for my students to travel, 45 minutes or so. And I was talking to Sarah Hayes, who was the director of the organization. And she was telling me that it was really tough to remain financially viable because she always had to write grants to bring in extra money to run the program. And to bring in grants, you have to be a nonprofit organization. So that was a barrier to running a small organization. But she also shared with me that she wanted to hire a dental therapist. And I had dental therapy students. So together we decided that we would plan a program to teach dental therapy students how to run a nonprofit dental public health organization. So it really met both of our needs as far as meeting my priority of finding a spot for my students, and it would give her the opportunity to kind of screen a number of dental therapy students that she perhaps would be able to hire. The next step that we look at is finding a point of overlap called mutual benefit, where both partners can see that they're going to benefit from this kind of a strange partnership that occurs when you bring two people together that usually don't work together. In our case, it really wasn't that tough because we both were dental organizations and we had a real tight goal of what we were after. But I did have to find funding through the Minnesota Department of Health, so I brought in a grant to fund the program. And the barriers that we had were usually, or the little issues we had were usually just little red tape things, just trying to create programs to meet the criteria of the university in my case, and just to fit it into her ongoing program. The next thing that we do is learn and adjust. In any relationship, there's always learning from each other, and we have to adjust as time goes on in a marriage, in a friendship, anything like that. But Murphy's Law is always present. If anything can go wrong, it will. And in our case, what happened is COVID. So as we all know, schools closed down and at the beginning of 2020, and we weren't able to continue the program for the very last cohort. Although Children's Dental Health Services was able to hire one of the dental therapists, and she is there today. She's now their clinic director. They've been able to open a second clinical practice in Austin, Minnesota, and Hormel came out of nowhere and built them a brand new dental clinic, which is opening next week. Last step is document and share. If you don't document and if you don't share the results of any program, it basically never happened. So it's important to find an appropriate way to share results based on who your audience is. In the case of children's, we had a teenager who came to the clinic whose name was Colton. He had extensive anterior caries, and Children's was able to restore his teeth, and his mother was so incredibly happy. She called the staff angels. And they were able to share this story in their newsletter, also gave the University of Minnesota Dental Therapy Program a little mention. And this report is still on their website today, 20teeth.org. The university report is a little more numbers-based, and the first column under 2018 shows our baseline data, just how many children they saw in 1 year. In 2019, that was when our dental therapy students were with the clinic, and you can see there was a little bit of increase in each one of our categories, our services that we provided. But after they hired the dental therapist, and she had been in her position for several years, the most recent data shows that we've seen incredible increases, like almost 40% in some cases, in the preventive procedures. But what I really want you to focus on is the restorations. They've increased their restorations by almost fourfold over that period of time, and that's why dental therapists were created, to provide services for underserved Minnesotans. So you're probably wondering where all the dental therapists are in the state of Minnesota. Well, right now we have 103 licensed dental therapists, and the little dots show you everywhere they are. They're in private practice, they're in community clinics, they're in very large practices. And you may wonder, well, why don't you do the same type of program in all these different communities? Well, community engaged research, again, it is based on what are the needs of the different communities. So we always want to go back to that first step and find out the needs of the community. Everybody has their own values and preferences. So this same program may or may not be something that is successful in other communities. So the next time you hear the word research, I hope that maybe this is the vision that you think of. And that's all I have.